Welcome to Mississippi Vein Institute. I am Dr. Manning and this is my partner, Dr. Adams. I founded Mississippi Vein Institute in 2008 with the goal of creating a medical practice that specialized exclusively in the treatment of varicose veins, spider veins, and venous ulcerations. Lower extremity venous disease is among the most common medical conditions to affect humans. I wanted to create a center of excellence for treating those specific problems. When we first started, it was just me, my wife Scarlett, and a 1,000 square foot clinic. We have grown into what you see today by consistently providing exceptional results for our patients. Scarlett is still my office manager and, believe it or not, is still my wife. The simple fact is that none of this would have been possible without her help. She is truly my better half. We have an outstanding team here at Mississippi Vein. Each person is committed to excellence in all that they do. We take great pride in our reputation for achieving truly life-changing results for our patients. Now let's get started by discussing why your legs look like they do.
Spider veins are small, unsightly veins that are located just underneath the skin surface. Some patients have spider veins in association with varicose veins, while others have spider veins alone. Spider veins are most effectively cleared using sclerotherapy. Sclerotherapy involves injection of a medication through a very small needle placed within the spider vein. The medication causes the spider vein to wither and die over a 6-week period. Patients wear compression hose for 5 days following a sclerotherapy session, and the only restriction is no hot baths for those 5 days. You can literally return to full activities immediately following a sclerotherapy session. We have you wear compression hose because they help sclerotherapy to more effectively destroy the spider veins. Good sclerotherapy destroys 60% of the existing spider vein burden each time it's done. Most patients go through 2 to 3 sclerotherapy sessions spaced 6 weeks apart to achieve a 90% clearance of their original spider vein burden. The spider veins that are destroyed will not return, but new ones can form as the years go by. Maintenance sclerotherapy sessions will be required to keep your legs in top shape. The front and back of both legs are treated during a sclerotherapy session. Sedation is available if requested, but most patients do not require it. If you want sedation, you will need a driver on the day of your procedure. Otherwise, you can drive yourself. You will leave the clinic wearing compression hose on the day of your procedure. We have high-quality compression hose that will be custom fit to your leg, available for purchase here in the clinic. You are welcome to bring your own. If you have them, just make sure that they are at least grade 2 compression in strength and thigh-high in length. A sclerotherapy session usually takes 30 to 40 minutes.
Varicose veins are dilated ropey veins that are a result of an inherited condition within a vein that cannot be seen with the eye. An ultrasound exam is needed to identify the underlying cause of the varicose veins. Leg veins have one-way valves within them that help to transport the blood up and out of the legs on its way back to the heart. A malfunction within these valves is what is inherited, and varicose veins are the eventual result. Varicose veins are most effectively treated using a procedure called endovenous laser ablation. A small laser fiber is inserted into the malfunctioning vein that is the underlying cause of your varicose veins. The laser destroys the bad vein and it is left in your leg where it is eventually reabsorbed by the body. This procedure replaces the old vein stripping that was done in the past. Your existing varicose veins are then removed through micro-incisions, which are so small that they are simply closed with a Steri-Strip. No stitches are necessary. Any associated spider veins are then cleared with sclerotherapy. You will leave the clinic with an ACE wrap on your leg which will stay in place for 2 days. You will then go into a thigh-high compression hose for 1 to 2 weeks. If varicose veins are present in both legs, each leg is treated at least 1 week apart. The same regimen regarding the ACE wrap and the compression hose apply for the second leg. The time period between treating each leg ensures a high degree of mobility in the days following the procedure and allows one leg to fully heal before treating the other. This time period only applies if both legs are to be treated with the endovenous laser. Some of you will have varicose veins in one leg and only spider veins in the other. In this case, both legs can be treated at once. You will be comfortably sedated for the endovenous laser procedure, so you will need to bring a driver with you. The endovenous laser, combined with removal of the varicose veins and sclerotherapy of associated spider veins, usually takes about 90 minutes. At the close of the procedure, members of our staff will wrap your leg with an ACE wrap, get you something to drink, go over your instructions with your driver, help you get dressed, and assist you to your car. You will have our phone numbers, including mine and Dr. Adams' phone number, should you need anything once you get home. You will be seen for a follow-up ultrasound exam 2 weeks and 3 months following your procedure. Your official after pictures will be taken at your 3-month follow-up visit. The chance of varicose vein recurrence following endovenous laser ablation is less than 1%.
A venous ulcer represents the most severe form of lower extremity venous disease. The ulceration occurs because of the same valve failure that causes varicose veins. Only a small percentage of the patients with lower extremity venous disease will go on to develop a venous ulceration. The ulcer is a non-healing wound that is located just above the ankle in most instances. The good news is that endovenous laser ablation of the underlying vein that is responsible for the ulcer's formation will heal the ulcer in almost all instances. Any associated varicose veins will be removed through microincisions, and spider veins will be cleared with sclerotherapy. There are some venous ulcers that cannot be treated with the endovenous laser, but those are extremely rare. Patients wear compression hose following the endovenous laser procedure until the ulcer is fully healed. Most venous ulcers heal within 4 to 6 weeks following the treatment with the endovenous laser, and they rarely recur.
Your next stop today will be for an ultrasound exam. The ultrasound exam is used to decide on the best course of treatment for you. You will then meet with Dr. Adams or myself so we can examine your legs, discuss your ultrasound findings, and formulate your treatment plan. All of your questions will be answered, and you will be shown pictures of the size of our incisions and the kind of results you can expect. You will then meet with a member of our team to discuss the details of your insurance coverage and to find a date to schedule your procedure. For those of you without insurance coverage, we will discuss the cost of your treatment. Let's take a minute to go over some of the most common questions we have heard through the years.
Don't I need that vein you're destroying with the laser?
The simple answer is no. The vein we destroy with the laser is abnormal and is the underlying cause of your venous disease. Destroying that abnormal vein will improve the venous circulation in your leg and help to prevent the formation of varicose veins in the future.
What if I need a heart bypass operation in the future? Won't they need that vein for the bypass?
The most common cause of varicose veins is malfunction within the great saphenous vein, which runs along the inside of your leg. That is the vein that is frequently used for a bypass operation, but there are certainly other options that can be used for a bypass graft. The great saphenous vein is by definition diseased when it is associated with varicose veins, and it would not then be a good option for a bypass graft. The majority of patients with coronary artery disease are now treated with coronary stents instead of a heart bypass operation.
When can I go back to work and full activities following a sclerotherapy session?
Immediately. The only restriction is no hot baths for the 5 days you're in the compression hose. Hot showers are okay.
When can I go back to work and full activities following a varicose vein procedure?
Most patients can return to work and full activity on the 3rd day. The day of surgery, you will need to elevate your leg for the rest of the day. The 2nd day is a 50% day. After 2 days, it's important to resume all normal activities.
What are the chances of a blood clot following an endovenous procedure?
The chance is very, very slim. Things we do to help protect you from the development of a clot are treating one leg at a time so that you don't slow down, and having you wear compression hose for 1 week following the procedure. Compression hose work to speed the flow of blood out of your legs, which helps prevent clot formation. The more you walk while wearing the compression hose, the better.
What can I expect after the endovenous laser procedure?
Your leg will be bruised where we removed your varicose veins, and you will have steri-strips on the small incision sites. The steri-strips will stay on until they fall off on their own. You will wear thigh-high compression hose for 1 to 2 weeks, except during showering and sleeping. You will be at full activities and can return to work once you are in the compression hose. In the vast majority of cases, you will be able to easily control any pain following the procedure with Advil, Aleve, or Motrin. If you are unable to take those medications, a different option will be provided. Most leg or foot pain immediately following the procedure is because the ACE wrap is too tight. The pain will be quickly relieved by simply loosening the ACE wrap. You may notice some increased tenderness along your inner thigh in the days following the procedure. This is because we slow the laser down in this area to solidly seal the vein. We do this to decrease the chance of any future varicose vein recurrence in the upper part of your leg. You may also notice some skin numbness along the laser course below your knee. The numbness occurs because of the laser's effect on sensory nerves along its course in this area of your leg. The numbness will resolve with time. We run the laser below the knee to decrease the chance of any varicose vein recurrence in the lower part of your leg. You will also have some swelling in your lower leg in the 2 to 3 days following the procedure. This is because we put 500 to 1,000 cc's of numbing fluid into your leg to protect it from the heat of the laser. The fluid slowly migrates into the lower leg and your body will reabsorb the extra fluid over the next 2 to 3 days. Wearing your compression hose and walking as much as possible will help the swelling resolve. You will feel a tightness in your upper inner thigh around 2 weeks following the procedure. This sensation is from the vein we treated with the endovenous laser. Your body is resorbing the vein, and the sensation that you feel is part of that process. The sensation is not something that will slow you down. You will not have to take any pain medication for it. You will simply notice it for a week or two, and then it will be gone.
What can I expect following a sclerotherapy session?
The spider veins that are injected will be red and inflamed. The truth is that the worse they look on the day of the procedure, the better they will do. The inflammatory process is what eventually destroys the spider veins. You will notice a small whelp at each injection site, similar to an ant bite. This will last approximately 1 hour and is nothing to worry about. It is caused by the release of histamine, which is why you will also experience some itching until the whelp disappears. Once you put your hose on, your legs will feel much better. You can take Tylenol, Advil, Aleve, or Motrin if needed.
Why do I have to wear compression hose following sclerotherapy?
Compression hose help the sclerotherapy destroy the spider veins. Sclerotherapy causes an inflammatory reaction within the spider vein, and the compression hose helps the sides of the spider veins stick together, which in turn helps to destroy them.
Why do I need an ultrasound exam if I only have spider veins?
Because some spider veins are caused by a problem deeper within the leg, and sclerotherapy alone will not work in that situation. That situation requires a combination of endovenous laser ablation plus sclerotherapy. Only until we know the result of the ultrasound can we accurately predict when sclerotherapy will be effective when used alone. Every week I see patients who have spent thousands of dollars on sclerotherapy through the years with poor results, simply because no one ever looked at them with the ultrasound and discovered that they in fact had an underlying problem that needed to be fixed before sclerotherapy would ever be effective.
What does insurance cover?
As a general rule, insurance covers the endovenous laser procedure and removal of the varicose veins, less your deductible and copay. However, you must understand that every insurance policy is different, and exactly what procedures your particular insurance policy will cover will be discussed with you in detail before leaving the clinic today. Insurance does not cover sclerotherapy for spider veins. However, we try to make the procedure affordable for our patients. Sclerotherapy is the polish on our work, so we want our patients to be able to afford it. Our patients are our largest source of referrals, so we want your final result to be something that we can all be proud of. We truly appreciate the confidence you are putting in us by being here today. You are about to embark on a patient experience that is like no other. It is what Mississippi Vein is known for, and I hope you have already gotten some sense of it by now. Your final results will be life-changing for you, and that is what we love most about what we do here at Mississippi Vein. The Lord has blessed this practice in ways that are too many to describe. I want you to know that Dr. Adams and myself rely on the Lord's help in taking care of each one of you. We pray for His guidance and direction in all that we do, and there is no question in my mind that our exceptional treatment results are an answer to those prayers. Thanks again for coming to see us. Now let's get busy rediscovering the legs you once knew.